Hi, this is Matt Kuntz. I'm the executive director at NAMI Montana. And for this Veterans Day, we would like to just kind of highlight some of the things that we've been able to work on through the years. And we're really grateful to our veterans, their families, and amazing collaborators and supporters, especially the Trans Montana Charity Ride. They have just been a remarkable funder that have allowed us to really show up year in, year out for veterans. And we also have amazing senators, congressional representatives, staff members like Emily Blair Rubright that showed up year in, year out and helped us really do this and make it happen. And whether it was, different presidents or Senator Tester, all of these different senators like Moran, they've all been there and we've been honored to be a part of it. So just wanted to go through what we've been working on from 2008 to 2025. Now, in Montana's veterans work, at least from a policy standpoint, really started with my stepbrother, Chris Dana. Our family lost him to suicide in March of 2007, and he was the reason why I came to NAMI. And we worked on this effort to improve screenings after his death. Those of the family got together and said, there's a million things that you could wish for, and we just wish for better screenings. And we got them in the Montana National Guard, and then got them through the entire country. The way that we got them through the entire country is through the National Defense Appropriations Act of 2010. This required person to person mental health screenings before and after combat deployments, and was put in force for the entire United States military. Talked to a number of members of the military where this is a really big part of what they did if they were deployed as mental health screenings or what happened to them and their buddies. We're not saying it's perfect. We're not saying anything is, but we wanted an in person, face to face screening. And if that service member says that they don't need help, that's okay. But it had to be mandatory that we ask. Um, the next legislative initiative was inspired by our dear friend, Commander John Scott Hannon. This is Scott with his Eagle Ruby that he worked with as part of his recovery. Just a really inspiring person and dear friend that we lost too soon. And we dedicated a major legislative effort in his honor. So that effort was the Commander John Scott Hannon Mental Health Improvement Act, signed into law on October 2020. The sections that we worked on, there were a number of them. First, it was section 202 and 203. It was report and pilot complementary and integrative care practices like yoga, mindfulness, service dogs, etc. To really figure out what worked with non-standard care. Then we had sections 302 and 304, which was to develop and implement clinical practice guidelines for mental health and suicide prevention, really to help those clinicians see what works and make it very clear this is what's been pr- proven to work and this is how to put it into practice. Section 305 was really near and dear to our heart. It was the Hannon Precision Brain Health Initiative with the goal of improving diagnosis and treatment of brain health conditions with a major scientific effort to figure out how to identify, uh, diagnose, and treat conditions more specifically. Whether it was studying brain scans or blood or all of these different ways, just realizing that we need to take brain health care into the 21st century and to create a large multi-year effort to do that. And that effort has already begun to see results. Section 507 was implement suicide safety planning in VA emergency departments. So VA emergency departments are one of the places where you're best able to intervene with veterans that are in suicidal crises. They come in there in the suicidal crises, and we have to make sure that every VA emergency department is able to give them the best care and the best planning for if they're going to go home. So we required that through Section 507. It was an evidence-based practice developed through Columbia with Dr. Barbara Stanley and another facility. But we're really excited to bring this to VA emergency departments around the country. Our next legislative inspiration was Mike Franklin. Mike Franklin was a West Point graduate. He was a Army infantryman, airborne, and then ended up becoming a chaplain in the Navy and settling down in Helena, Montana, to be a college counselor at Carroll College, and just really beloved by our entire community. And we eventually lost him to treatment-resistant depression, and he became a really big inspiration for the work that we did after that. And that work came to light through the Joseph Maxwell Cleland and Robert Joseph Dole Memorial Veterans Benefits and Healthcare Improvement Act, which was signed into law December of 2022, also known as the Cleland-Dole Act. Section 191 was that one that was so much inspired by Mike Franklin, and it was forcing the VA to look at how to better care for treatment-resistant depression. These are veterans that are at the highest risk of suicide. All of these other different types of care modalities like therapy and medication didn't work. And where do you go after that? And it was in the clinical practice guidelines, but the VA wasn't delivering the care. So that was why we required it through Section 191. And we're really happy about how the VA has implemented. Now we have TMS machines and ketamine and lots of different alternatives around the country where before there just wasn't. Another big part was Section 181. This is a really nerdy section, but it was super important for VA researchers. It was the Paper Reduction Exclusion Act for VA research, and it was purely getting rid of something dumb, just a bureaucratic barrier. There was a law called the Paperwork Reduction Act in the 90s and probably had its place in a lot of different things, but what it did was create a nightmare in the VA. So every piece of VA research had to go through this Paperwork Reduction Act process, and added 6 months, added a year, and it really slowed down essential research. So it's important to get that exclusion across in order to help give our veterans the best care possible without stupid bureaucratic barriers for research. Another part of the Cleland-Dole Act was Section 192, and this was including VA peer specialists in the VA's healthcare accounting system. So administration after administration had made it a point to hire veterans to care for veterans as peer specialists. Everybody thought it was a great idea. Everybody pushed it. The mental health community, we pushed it in Montana, but it always ended up faltering. And why we figured out that it was faltering, and this was part of the cover commission where we got a lot of these great ideas from, is because the VA accounting system didn't have a section for peer specialists. It had all of these different other sections for clinicians to count for their care, but none for peer specialists. So it was really a important change. And I know, at least in Montana, since we passed this, the number of peer specialists has went up 10 times. And I'm expecting that to be the same around the country. It's a critical thing. Veterans helping veterans. Great for the veterans and their families. Also great for relieving some of the burden on a really overwhelmed clinical workforce that shouldn't be doing basics of support that a veteran peer specialist can be doing. Next is Section 193. We're excited about this. This is a gap analysis of psychotherapeutic interventions at the VA. At the time, it was really unclear what the VA was offering and what the VA was not offering. So I remember seeing this firsthand when, during the cover commission, we toured two different facilities in Chicago. And one of them offered EMDR and the other one didn't. And it was just shocking because nobody knew that they were offering two different types of psychotherapy, and both claiming that they had research proven reasons for offering what they offered and for not offering what they didn't. So this required the VA to do a gap analysis and figure out what psychotherapeutic interventions were being offered at the VA, and were they the right ones or did they need to be changed. Next up is the Senator Elizabeth Dole 21st Century Veterans Healthcare and Benefits Improvement Act. It was passed in January of 2025. And what we were going after with this section that we worked on was value-based care planning and pilot program. So the VA's accounting system again has that issue that we saw with peer specialists, but it's all the way across the board. The same thing that we saw with treatment resistant depression care is okay, we had to legislate that. We have to legislate peer support. You can't legislate everything for an entire healthcare system. And the problem is that they were running off of a 1990s era fee for service model to fund care throughout the VA. It was really popular in the 90s. Since then, most of the biggest and best healthcare systems in the United States have moved more towards a value based care planning and delivery model. And that is more focused on trying to get the people better, trying to make sure that they have whatever works to get them to actually improve. And that might be housing, it might be some other kind of non standard care like peer support, it might be something more intensive like transcranial magnetic stimulation for treatment resistant depression. It is really a very broad package, but it incentivizes VAs across the country to be more flexible, figuring out what their veterans need to really make serious improvements in their health. And then it incentivizes the different regional VAs for being successful at that. So we've done a lot, but it's not enough. Absolutely is not enough. And we're just, small organization with great partners that continue to push. But we have to keep going. And we are going during the current Congress. And we'll highlight first, we have Senate Bill 800. This is really focusing on low level blast injuries that has come to the forefront partly because of the Hand and Precision Brain Health initiative, as there's been a lot of veterans that had low level blast injuries that occurred during like training and stuff like that, and really has dramatically altered their brain health, their mental health, and we need to better understand these conditions. We need to better understand how to prevent them and how to care for them. And this has some great research practices and other things to help just improve how we deliver care and prevent these injuries for veterans. Next thing up is we do have a brain imaging appropriation. Millions of dollars that's been cut from the VA budget for brain health research, imaging that we're putting back in the budget because we need it. We do need to get better at understanding these conditions. And part of it starts with research. Some of that research involves imaging. The next bill is going to be out of the Senate. We have not formally announced it yet with our partners, but it's going to be a full VA research reform initiative. From our perspective, the VA research system hasn't really changed since the FDA was created, and it needs to. There are a bunch of different things that need to change to be able to modernize the VA research system and allow it to be more nimble, especially when it's trying to get things to the veteran. Because we have enough programs that just don't get far enough. And it's heartbreaking for those of us that have loved ones that desperately need them. The next one is another bill that's not released yet in the Senate, and it will be to fund open label psychedelics research. This is what we believe to be the next step forward in psychedelics research is large scale open label trials that allow a bunch of veterans to be able to participate in psychedelics in a very restrained and safe manner, constrained, research grade psychedelics, research grade practices, and patient security, and all those things. Let's do this right and move the science forward at the same time. So, those are the four big efforts that we have going right now. And we try really to be incredibly tangible with each one of these. Hopefully, you can see that in our work and what we've been able to get past. But we just want to say that we're so grateful to all of our collaborators, our donors, like the Trans Montana Snowmobile Riders, amazing senators, presidents, everybody that's been able to do this has been massive efforts over the course of years and years. And we just can't do it without a ton of amazing help. So we're so grateful to it again for Senate staffer Emily Blair Rubright, who's been so critical in all of our efforts for at least the last decade. So we're incredibly grateful. Thanks to all the veterans and their families. We hope everybody has a wonderful Veterans Day, and let's get back to work to continue working to save the lives of our veterans that live with brain health conditions. Thank you.